This institute is providing one of the best onco cares under one roof.
So SKIMS is a model institute not only for region of UT of J&K Ladakh. It is one of the model institutions for country also. There are very few institutes of this magnitude. We celebrate some function on this day with some theme, and today we thought let us do it differently. That in last few quarters, 3 quarters of my tenure, we have worked very hard, and I place on record my colleagues, Medical Superintendent Professor Farooq Jan, Professor Fazil Saab, who was my Chief Material Management Officer here. There is Dr. Yatu Hospital Administration Head. He also helped in executing a lot of these new equipments. Dr. Iqbal Saab. And we actually, Dr. Muhib Saab, he is in charge of engineering. So there is a list of equipment. We have 150 intensive care beds. Each bed costs 70,000 rupees. So we have radio frequency ablation machine. One machine. We have laparoscopic. This is called 3D 4K visualization tower. This will be for kidney transplant. We have got operating microscopes, and this altogether, this whole equipment costs around 45 to 50 crore. We have also ordered another linear accelerator plus some ventilator, 25 ventilators. Inshallah, we have raised demand for another 55 crores, which will be done with the new budget release in next few months. So I thank my team, and we will maintain where we utilize all money, we will try to maintain utmost transparency in future. And in this bargain, in this process, we are open to your criticism, your suggestions, valid suggestions, and you should always tell us if you feel that anywhere we have add on some side, or we have done something, we are always open to your suggestion. That is what we did. One public darbar, we will do public interaction. We will also see how public actually sees us, how they rate us, and what are their demands, what are their suggestions. We are open to those suggestions. In that the processing of departments was late, or whether material management office delayed it late, or whatever has happened, it is not there to, God forbid, we want to fix anybody. But we want to learn कि अगर कहीं गलती हो गई, हमें आगे नहीं होनी चाहिए वो गलती.
What happened last 3 tenures, it's open in public that funds were not utilized.
Sorry?
No, funds were not utilized previously, and this time, since you took over as the director, you have utilized the funds, and everything is in black and white. Normally what happens in past, we have seen that there were a lot of allegations of corruption. If you remember a previous guy, I won't name him, in his time there was an allegation about corruption in recruitments and purchase of the equipment. So how would you counter that? How would you counter that? Because that is the large fear an official has when he is at the helm, that he may not be caught. He may not be subjected to allegations and all.
When I joined 2-3 times, ACB teams visited us. We provided them all the documents, what has been available. Let me tell you, all of you, be assured that SKIMS is the one institution. I have worked in AIIMS, I have worked across outside country also. SKIMS is one institution which has a very robust purchase system. Allegations of corruption can be raised, but proving that allegation is what matters ultimately. I do not think there is much scope of corruption. See, there can be.
I am not talking about the scope.
Exactly. See, what we are trying to say. See, there is the most of the machinery, most of things have been now taken over by a government agency, okay. JKMSL, and they are actually doing the whole process. From institute, I am providing them experts. Experts will advise them for technical specifications. Other colleges, other experts are also there. They actually shortlist a machinery. We do not have any problem in that we are selecting X or Y.
Fair enough.
Our process is now smooth and transparent. Even if we have a tender, we have all the mechanisms there that we do not favor anybody. Now there is a GEM purchase, there is a JKMSL, or our in-house purchase has a proper mechanism.
One is that SKIMS is primarily a tertiary healthcare institute. Have you ever thought to just submit, to chalk out some plan and share with the government that how can we bring down the referrals from the district, sub-district hospitals so that the burden is eased out on the SKIMS, resulting that we face a lot of hardships in the emergency healthcare. Emergency department of the SKIMS is the most affected department by those unnecessary referrals. Have you ever thought to submit any kind of proposal or to share with the government your recommendations that we can bring down those referrals? Point number one. Point number second is that the number of cancer patients is rising at an alarming rate. What is SKIMS doing to go for mass awareness about the rise of cancer in Kashmir, particularly maybe about the food habits and other lifestyle issues? And third is that what about the commissioning of PET scan? PET scan for SKIMS.
SKIMS is a model institute not only for region of UT of J&K Ladakh. It is one of the model institutions for country also. There are very few institutes of this magnitude. अभी एम्स न्यू दिल्ली के फोटोकॉपी 26 इंस्टीट्यूट्स बने, but believe me, almost all of them are still below the stature of Sher Kashmir Institute of Medical Sciences. None of those institutes have yet taken over. Buildings बनी है, मशीनें आई है, लेकिन उनकी performance in academics, in patient care and research will take decades to reach this level. We have already taken a lot of miles in this direction. But problem is one, that we are ourselves sometimes degrading our own system. Yesterday I circulated a video given to me by Director SKIMS Jammu, and video taken in the evening of the campus, looking very beautiful. I circulated in my group. Everybody was saying very nice. All the people, all media, public, everybody praises that institute has come up very well, SKIMS Jammu. When it is not performing for patient care, nor research, nor teaching yet. The machine doesn't matter unless you have trained, skilled manpower. So having trained, skilled manpower of SKIMS standard, it will take at least 20 years for SKIMS Jammu to reach that. So we underestimate this. We degrade our own trained, skilled doctors. We talk negative about them. He talks about me, I talk about him. So that has been a problem in our public as a general. So when I took over as director, I receive every day 20-30 complaints about each other. And it has a scope of going to the international map, provided we actually take those initial objectives seriously and we take that path. We should have very clear vision. We should not divert. We do not need to actually compare ourselves with any medical college. We are a big brother. All the medical colleges we have to handhold. We have to take all these district hospitals, give them direction. I have been given the charge to look into the area of developing super specialty facility and super specialty qualities and courses in all these medical colleges. Recently, there was a meeting held under Chief Secretary Saab. So I gave a plan, and that plan has been given 1 month deadline to be implemented. So regarding the referral system, there is another committee constituted under my guidance that all the principals and district hospital health service directors will be formatting a plan that will give them that referral system has to be structured. It is not that every patient can walk into SKIMS, everybody patient walks to medical college. No, we have to structure. If there is a patient which can be taken care in sub-district hospital or a dispensary, should not come to tertiary care. So if we do that, then we will get a time, and our instruments and our experts will be working for those patients who need us. We will not be wasting time on Nazla, Zukam or simple problem.
Will just be successful in reducing the unnecessary.
Yes, we have given a proposal to the government in 3 phases. In phase 1, we proposed 1 year. That is where we will have these 7 types of services which will be implemented in medical colleges. That is cardiac care, stroke care, cancer, then we have emergency medicine, critical care. These will be, and dialysis. These should be available in every medical college, and SKIMS will actually guide, hold their hand and provide our expertise, so that we will also do outreach program there. Our experts will be going, starting services there and helping them to start those services, so that the burden to us is
minimized. And
let me tell you, it is a responsibility of all of you to educate public properly. There was a actually direction from government that health department was called that you should have PET scan in every district hospital. Let me put things in proper perspective. PET scan is an instrument which sees any tissue which is metabolically more active. So it doesn't mean it is cancer, it can be only infection. So what happened is general public got this notion that PET solves every problem. And PET is being misused by lot many people. Sometimes people come, no, मुझे PET करा दो, डॉक्टर को फोर्स करते हैं, और कुछ डॉक्टर भी ज़्यादा ही यूज़ करते हैं इसको, general practitioners. PET scan is to be used very selectively, and in fact I told officially to the government last time that there are 2 PET scans, one in Jammu. They are starting there. We already have one here, and there are also 2 PETs in private. I think in J&K 4 PETs are good enough. But what happens, the PET scan which is put by private is a low acquisition instrument, and they use a lower activity. Sometimes it adds more to confusion than solving a problem. So you should also play your role that in public that don't have this notion that PET solves every problem. So they pressurize us sometimes, oh PET बहुत ज़रूरी है sir, ये नहीं क्या हो. So I have to also recommend many PETs for without actually people needing it, because I have social pressure.
ज़्यादा ज़रूरत पड़ती है वो लोग पहुंच नहीं पाते हैं.
हाँ, obviously when you put a long queue, unnecessary people take the place of those people who need it. So we have to also put these things in perspective. We have constituted a medical board here, multidisciplinary board of 5 cancer related departments. So they will be discussing cases that where it is mandatory to PET, where PET will help us. As I told you, PET helps us in staging. PET may help somewhere in difficult diagnosis. Otherwise, we have other ways of knowing the diagnosis.
One day also we increased.
Huh?
We increased 1 day for PET.
We were doing PET for 4 days. Now we have increased it 1 more day. We are doing 5 days PET. And once this medical board will see judicious use of PET. So then the waiting times are definitely going to go down.
You have also raised it that very much important thing
About PET.
autonomy of SKIMS, about
Autonomous stature of the
institution regarding the financial concerns and tendering and purchasing and stuff of SKIMS. Since now the new government is formed, so how we can address this concern, and what do you want to say about the autonomy of SKIMS and the stats right now?
These are the words which actually sometimes mislead people. This is not Director SKIMS or me in the administration who can comment on this. So there are debates, there are different platforms where debates are happening on
Last time
this.
CM did.
So,
Last time CM was here. He told that SKIMS needs autonomous stature back.
You got some relief from since the government is formed.
We are asking about the progress in this contest.
Progress in this context.
Just put this in this.
Is there any progress in this contest?
Is SKIMS autonomous or not?
No, see, I have not received any order that you are not ex officio secretary or you are not autonomous. So autonomous means I say auto. Sometimes you become autonomous. जो ऑटो है ना हमारा 3 व्हीलर वो कहीं भी टर्न करता है तो वो autonomous है. मतलब I am performing my performance. What I need, I would like to perform on an international platform, at least in India, like AIIMS New Delhi and PGI Chandigarh. For that, it is not autonomous only that even patients do not demand that much, even journalists don't interfere that much, even employees do not use unions that much. That is what autonomy I would like to have. Of course, government has its own.
Are you independent to take decisions?
Sorry?
Are you independent to take decisions? Because there were concerns about
relying
the
on the
tendering
LG
and
office or
purchasing
the
of equipments for SKIMS, and that was raised by the SKIMS officials many times. And when CM was here last time, we asked the question about the autonomy of SKIMS, and lot of
My functioning is that I have consumed all grant. I am doing promotion in the next room. DPC is being done. I have put all the new advertisement for recruitment. Do you understand? Sometimes if you do not want to do something, if you are lazy, you take the shelter of some excuses. I don't think I have any excuses.
Started today, commissioned today. What is the staff that you have for 150 additional ICU beds? Because ICU beds need a lot of doctors, a lot of nurses. Are these going to be just beds or will they have...
The discussion with heads of departments, we found that SKIMS needs 100 ventilator beds. Because we have 1247 beds, we need 120 intensive care beds with ventilator facility. While we had, when I joined, we had 32 or some odd beds. Currently, we have expanded it to 45 to 50 odd ventilator beds. Now, my endeavor is in next 6 months, we should have 100 beds with ventilators. For that direction, we have already purchased 25 ventilators, which will be any time delivered. We have also put 27 of our old ventilators for service contract, which should be, 25 of them should be working. That will make 100 ventilators. We have purchased 150 monitors. They are not been delivered. They will be delivered any time in next few days. And we have got 150 these ICU beds. So we also need oxygen for that backup. So we have also put a tender for 2 oxygen plants, 1250 liters each. So that will be the instrument part of it. Regarding the space, we have already found place. Third important point which you said is the manpower. For manpower, we have already put, when I will promote 400 nurses in this sitting, and I will have 400 nursing posts vacated at junior level. Those we will recruit in next few months, 2-3 months. In any eventuality, I think even if things get delayed, in 6 months we will have this dream. Actually, when we'll have manpower, as well as we are also 760 posts being advertised by SSRB. They will be taking 3 to 6 months for recruitment. So in 6 months, I understand if everything goes well, we should have these 100 and 110 ventilator beds in place. The discussion with heads of departments, we found that SKIMS needs 100 ventilator beds. Because we have 1247 beds, we need 120 intensive care beds with ventilator facility. While we had, when I joined, we had 32 or some odd beds. Currently, we have expanded it to 45 to 50 odd ventilator beds. Now, my endeavor is in next 6 months we should have 100 beds with ventilators. For that direction, we have already purchased 25 ventilators, which will be anytime delivered. We have also put 27 of our old ventilators for service contract, which should be, 25 of them should be working. That will make 100 ventilators. We have purchased 150 monitors. They are not been delivered. They will be delivered anytime in next few days. And we have got 150 these ICU beds. So we also need oxygen for that backup. So we have also put a tender for 2 oxygen plants, 1,250 liters each. So that will be the instrument part of it. Regarding the space, we have already found place. Third important point which you said is the manpower. For manpower, we have already put, when I will promote 400 nurses in this sitting, and I will have 400 nursing posts vacated at junior level. Those we will recruit in next few months, 2-3 months. In any eventuality, I think even if things get delayed, in 6 months we will have this dream. Actually, when we'll have manpower, as well as we are also 760 posts being advertised by SSRB. They will be taking 3 to 6 months for recruitment. So in 6 months, I understand if everything goes well, we should have these 110 ventilator beds in place. Yesterday, we took 3 decisions. Day care में हमें 40 बेड है, तो पेशेंट अक्सर 120 to 180 डे केयर जिनको कीमोथेरेपी देनी होती है 180 होते हैं.
But let me tell you, government has also taken a very nice step. Let me introduce, I am Dr. Fazal, I am working as SKIMS Medical College Principal right now, but I was working as the Chief of Procurement, still continuing on that post, that's why I am responding to this. So, government has taken a very, very important step this year. There is something like we have preventive oncology concept in medicine. They have preventive corruption systems now. This year a team visited here, they were here for at least 4 days, I think. Mr. Zubair was actively interacting with them. They were educating our system, our Department of Material and Management, our Finance Department, how to save yourselves from unwanted charges of corruption, unwanted charges. Because many a time is what Ashraf Saab said, it's not basically the corruption. System is very robust, but many a times things happen out of ignorance. Because a doctor is heading, purchase department out of seniority or something, but he may not be technically knowing the right. But there is a very robust system, technical experts are there, financial experts are there, everything is processed through a proper channel. And these allegations have never been proved right. But what has given us a big relief this year, number one is the Director Sahab was very persuasive that we should consume the budget. I also acted very persuasive, our employees acted very persuasive, and JKMSL was a great help. Let us admit it, even though we in the past didn't have an experience with JKMSL, it was a great help. But what it needs is 1 or 2 experts from SKIMS also. So that, because they are most of the time selecting equipment for medical colleges, but there are some very specialized equipments for institutes which are especially needed. So that time our expert will be of help to the system. Here under one roof, and that's why in spite of, and people have a notion that most of the people are not getting treated here, wo bahar bhag jate. Trust me, I have the statistics with me. 5,000 to 6,000 patients have been treated at SKIMS who had cancer. 5,000 to 6,000, and out of that, 52% of the whole J&K cancer load is borne by SKIMS only, 52%. In spite of having so many hospitals, only out of these 6,700 to 800 patients have gone out for treatment. ये जो हम बड़ा बोल वाला करते हैं जी, बहुत सारे भाग जाते हैं दिल्ली, बिल्कुल बकवास है.
Patients in onco department, that is lack of coordination between the staff who are responsible for registering the cases under golden card scheme. So they take a lot of time, which also results in the delay.
Yesterday only I gave direction. वहाँ पे मेडिकल सुपरिटेंडेंट साहब भी थे और हमारा एक्चुअली उसके इंचार्ज प्रोफेसर युतुबे थे. दोनों को डायरेक्शन मिली what we did 2-3 changes yesterday. एक हमने वहाँ पूरा एक फ्लोर थिएटर, बोन मैरो, ट्रांसप्लांट एंड 2-3 ट्रांसप्लांट एरिया है और वो उसमें हम उसका काम शुरू हो जाएगा इस हफ्ते. दूसरा वहाँ पे हमने 16 बेड्स को पेइंग वार्ड डेडिकेट की, 16 रूम्स. सो कैंसर केयर के लिए एनीबडी वांट्स टू टेक पेमेंट वार्ड तो वी विल गिव दैट नाउ. वो भी इसी हफ्ते हम उसको कोशिश करेंगे. तीसरा जो आपने बोला कि आयुष्मान वाला कार्ड, वो हमें डायरेक्शन दिया हमने. वो आयुष्मान यहाँ फैसिलिटी एक ही जगह होती थी. व्हाट आई डिड, आई डिसेंट्रलाइज दैट. हमने आयुष्मान कार्ड हर एक वार्ड में ही लगाते हैं. एक बंदा है, कंप्यूटर है, उसको वहीं पे, ताकि कोई पेशेंट को फाइल लेके उधर उधर भागना ना पड़े. उसमें एक डिफिकल्टी अभी है हमें कि जो आयुष्मान का मेडिसिन और जो सप्लाईज है, वो जो पुराने वेंडर अभी है उनकी तरीके से थोड़ी डिफिकल्टी है. कभी कभी मरीजों को बाहर निकलना पड़ता है. वी आर planning that inshallah in coming days that will also be solved. It will be available within our counter.
का सीनियर रेजिडेंट फील करता है कि ही नीड्स एडवाइस फ्रॉम सीनियर कंसल्टेंट, कॉल जाती है और हमारे डॉक्टर साहब आते हैं, रात में ऑपरेट करते हैं. रात भर सीनियर डॉक्टर्स हमारे थिएटर में ऑपरेट करते हैं. हमारी जो कैथ लैब है उधर प्रोसीजर्स करते हैं, रेस्क्यू टीसीआई करते हैं कार्डियोलॉजिस्ट हमारे. तो ऐसा कोई चीज़, ऐसी कोई ये नहीं है कि हमारे सीनियर डॉक्टर्स अवेलेबल नहीं है. हर टाइम पे एक तो पोस्ट डीएम और ये सीनियर रेजिडेंट्स हमारे वार्ड में होते हैं. जब भी ज़रूरत पड़े तो विद इन अ शॉर्ट स्पैन ऑफ मैक्सिमम हाफ एन आवर द कंसल्टेंट इज अवेलेबल इन द वार्ड. और कोई चांस ही नहीं है कि कंसल्टेंट नहीं करेगा. ही विल नॉट बी.